Yes, we can start. Good evening all and good evening doctors. Myself Sankalp Sane, Marketing Manager from Innovcare Life Sciences. Welcome all to this interactive show, the Punit @Ritu show, supported by Innovcare Life Sciences. Today we have a very special guest on our show, the teacher of the teachers, Dr. Hema Divakar. Welcome, ma'am.
Namaste. Welcome, very warm welcome, ma'am.
Thank you, Ritu.
Yeah.
It is important for us to understand what makes Punit show unique and special. It is a knowledge sharing platform for experts as well as young doctors. The perfect mixing and mingling done by Dr. Ritu when it comes to strike balance between basic questions and advanced questions, not only from India, but doctors from across the globe are getting benefited from this show. It has covered all the aspects, be it the gynecology, obstetrics, sexual wellness, women's health, medical-legal aspect, and others. So with this, I will request Dr. Ritu ma'am to introduce our special guest, the teacher of the teachers, Dr. Hema Divakar ma'am.
Yes. Yeah. Friends, as all of you agree with me that knowledge has a beginning but no end. With this motto, I always invite some stalwarts from our fraternity, a very knowledgeable persons who believe in the knowledge sharing. So I'm here, your host, Dr. Ritu Santwani, Director of Shyam Well Women Clinic, Pune TestTube Baby Center. Our today's guest is very, very special, very dynamic, very energetic, so knowledgeable, madam. Hema of the Foxy, Dr. Hema Divakar. A very warm welcome to ma'am.
Namaskar. Thank you, Ritu.
Namaskar. Ma'am, these lovely roses for you, for our Hema ma'am.
Thank you.
So, friends, as all of you know that Hema ma'am is the teacher of teachers. Wherever you go across the globe, if you say that anyone can recognize the India by the name of the Hema Divakar ma'am. Sankalp, can I have a biography of ma'am, please?
Yes, sure.
Yeah. Sure. Yeah. Yes. Make it full screen. Yes. Friends, as all of you, Dr. Hema Divakar madam. Madam is MBBS DGO, MD, FIC MCH, FICOG, PGD MLE, FRCOG. Ma'am was President Foxy 2013, Technical Advisor for Government of India for Maternal Health, Consultant Divakar Specialty Hospital, Bangalore, CEO Chairman Artist, Asian Research and Training Institute for Skill Transfer. Ma'am is Vice Chair for the FIGO NCD Committee, National Coordinator for Capacity Building Diabetes in Pregnancy. Here I want to add GDM and Dr. Hema Divakar ma'am. Wherever is the discussion for the GDM, always the first name come in the mind of the Dr. Hema ma'am. Yeah. Ma'am, thank you so much for enlightening for this. Yeah. Ma'am has so many awards with her. I think he mentioned only some few awards. The ma'am is FIGO Woman Achiever, Great Brand, Great Leaders, Healthcare Excellence, Global Asian of the year 2018 and 19, CME Excellence Award, CSR Impact Award. Yeah, next please.
This much only, ma'am.
Yeah. Okay. So before we start, I want to say 2 lines for you.
जी.
Ma'am, this is in Hindi. Ma'am, मैंने बहुत अच्छे से ढूंढा है आपके लिए. These lines totally fit for you. Ma'am, this is like this. अच्छी संगत बैठकर संगी बदले रूप. अच्छी संगत बैठकर संगी बदले रूप. जैसे मिलकर आम से मीठी हो गई धूप. So whosoever is coming in contact with Hema Divakar ma'am, वो उसको कहीं ना कहीं से तो एनर्जी मिलेगी ही मिलेगी. हाँ, और कुछ ना कुछ करने का एक जज्बा जागता ही है. मैम इज so inspiring and I'm very much thankful to ma'am. When I requested ma'am to come in my show, ma'am ने बिना कुछ बोले immediately ma'am is agree. So ma'am, it's I'm really honored that you have accepted our invitation.
मैं भी कुछ हिंदी में बोलूं, रितु?
Yes ma'am, yes.
संकल्प और सातवानी की जब ये साथ हो जाती है
अच्छा.
तो संकल्प का मतलब ये होता है कि you determined to do something. आपको जो करना है वो करना ही है. सातवानी का वैसे मैं एक्चुअली मीनिंग नहीं जानती हूँ, लेकिन साथ देना उतना तो मैं जान गई. Okay. तो हम साथ साथ जुड़ेंगे, साथ साथ रहेंगे, साथ साथ काम करेंगे, और खूब आपको बधाई on this very very novel concept of Ritu Santwani show. Thank you.
Thank you. Thank you so much, ma'am. Yeah. Ma'am, so with your permission, shall we start our happy virtual hour?
Sure.
Yeah. So, ma'am, before we go to the presentation, ma'am, here across the globe, everyone is inspired by you. So, ma'am, my first question to you, what's your secret sauce to success?
Okay. I really think that you just follow both your heart and the head. Okay. Because sirf ek se kaam nahi chलता, that is why I said saath saath. You to, have some presence of mind, some practicality, some common sense, which has to be merged with what your heart feels and how your passion takes you along. And when you walk along this journey, not only that you enjoy doing what you're doing, okay, but you get more energized by what you're doing because you just love it. And that is perhaps, there is no secret about it. That is the sauce, if you want to call it the sauce. And success, the other people see it as success. But whatever you do, if you see it as your satisfaction, there's a very thin line, Ritu, between success and satisfaction. All successful people seldom are not satisfied. But you're satisfied, then you're surely successful for yourself. Okay. However, the world may see you or not see you. So that is what I would think is primarily very, very important. Through your head and through your heart that you're doing right. Okay. At that moment, what you think is the best and what you think is the right, because humans, we do make mistakes, but was your intent correct? Did you put in your best efforts? Did you do what is expected of you? And you just get into an action mode and do it. Success, satisfaction, sauce, everything comes along with that. That is really what my journey has been, that I have never looked back to say, 10 years ago, I could have done it. Just do it, because to win, you must begin. So just get started, learn your lessons along the way. There may be 1,000 failures behind one success. People only see the success, but the failures are your own personal lessons,
True.
which you should treasure more than what people think about the success, because those lessons are what has made you what you truly are.
Thank you so much, ma'am. Ma'am, all are curious to know that what motivated you to become a doctor and especially a gynecologist.
You have to take the story 50 years back. What was it, Ritu? What were we offered? If you're from a family which can have access to education, the girls and boys, two definite compartments, doctor, engineer.
Yeah.
Okay? So it is not so much by choice, but by default also, you can say that, you're doing well in your studies, so the doctor bani jayegi and all. And right from my grandpa, there are lots of members in our family and extended family who have gone into medical profession, because for us, teaching and knowledge, we, really keep it as our very prime, precious, priceless properties. There is something in us which nobody can steal. That is our knowledge. Whereas the whole family, the culture is like that, and we truly believe in always learning whatever we can as we go along. And that is, to get into medicine was something that had to happen, because so much of opportunity of a variety of things, what the present generation is exposed, we truly did not have. It was just a simple thing of access to education. Can you or can you not? That's all. And then, the track of moving ahead in the much traveled path. And we were all kind of culturally guided not to be weird, not to try anything out of the box, not to go and do some adventurous, dramatic things. Seedhe raaste pe aage chalo. That was how, our path was laid out, I must say. And then we were quite happy to walk along that path. And as we moved forward with the OBGYN practice, originally, the surgery is something which I loved, so I wanted to become an orthopedic surgeon.
Okay.
So that is like completely, I was just weighing 48 kilos, and then, nobody said, this is mad, you want to become orthopedic surgeon, because the impression was that, you have to be at least to saw the bones, etc. So that kind of weird thoughts were not obviously encouraged. So the next best opportunity for surgery was in OBGYN. And as we got into the thick of it, then so much got built around it to reach every girl, every woman, and so many other factors like gender inequities and how she's not allowed to make her own decision. Even though she may be affluent and she may be educated, but still there is something that she keeps the peace of the family by going along with the family decision. So all these things also really started adding on more masala to the technical, the rendering of the service to girls and women. So it kind of built over, and we have reached where we are trying to do our best at every possible touch point and the opportunity with the community.
Great, ma'am. Great, ma'am. Thank you so much, ma'am. Some doctors are requesting for starting for the presentation. Yes, ma'am. First, we have your presentation. Vaibhav, please mute all the participants except madam and me.
The participants have given us a clear hint that abhi बातें कम करो, काम शुरू करो. Thank you. That is why we said, my message to all the young people who are watching this show, the Ritu Santwani show, always, innovative ideas can come from everybody, inclusive of this brilliant program put up by Ritu. It was just not her idea. She has implemented it. So that gap between innovation and implementation is what everybody has to bridge. And that makes an impact of the late night Saturday virtual happy hours that brings along some delightful deliberations. And the topic today is also about research to reality. Just by researching in some corner or just by innovative thoughts in somebody's heads, things don't happen on the ground and you can make no impact. So what are the challenges in translating those evidences into practice and way forward for achieving the best possible care for our girls and women, spiced with all these other issues that I already mentioned. And we bring from our organization, which is called ARTIST for her. ARTIST expands, as you can see, Asian Research and Training Institute of Skill Transfer. The art of artist, as I call it, A is for advocacy, to keep on talking and just getting the women to get sensitized to what they deserve and what their rights are. R is the research, because unless we know what is happening and document it, we will not be able to learn our lessons. T is training and capacity building. Now these women are empowered, they are aware, they can access, they can afford, they come to you, but there is nobody there to take care of them. So the healthcare providers' capacity has to be built. That is the training component. So again, this Artist for Her has come into existence, dear friends, with the idea of making our promises a reality. Because you've got to have a blueprint, you've got to have a strategy to work towards making a difference. And one of the major missions that we have started is the Manyata initiative, which is now a flagship initiative through Foxy. We were talking endlessly about the maternal safety, maternal mortality, and how the care is not reaching the women, and how the human resources, the staff nurses who are working with us, we are not empowering them enough to do their bit. Madam ko phone lagao, madam aayegi, instruction degi, then only they can do. If the madam lands up late and the patient is collapsed, pehle nahi bulaye, and ye and that scenario has to change. They have to know what is the golden minute and the golden hour, and the one who is there doing their job of catching the babies should know how to manage the situations. So we say that, what do you base your clinical practice on? Is it training? Is it clinical experience? Is it the consultations with is it the peer group? Or is it through a lot of reading, journals, articles, case notes, somebody somewhere has done, why not I, etc.? Or you put the cards on the table, let the patient decide. So is it the patient's preference, or you are really serious about recurrent pregnancy loss? What is the latest trial? That too a randomized trial. And what has the meta-analysis shown? If you are practicing evidence-based medicine based on all this, okay, congratulations, you're doing a good job. What is the reality? What happens many, many years after you graduate and postgraduate? The slope for the knowledge is so slippery. 5 years, 10 years, 15 years, 20 years down the line, things have changed. Things are changing by the minute now. And you are running down a slippery slope because there's so much information and so little time. Because we have so little time, Ritu has called us at 9:30 at night. So that whatever available time, whenever we can meet each other, let's brainstorm and discuss and see what better we can do. So to search and retrieve the best evidence, and maybe you'll enthusiastically do it for a while, but otherwise you'll say, okay, I heard this in that lecture, and then you're not even, back checking whether what was told to you was right or not. So it is a practical difficulty that you do not know. How this evidence-based medicine reaches practice. Now it is, as I said, every minute you may get a new literature on COVID, and you'll start changing your line of thinking. So many uncertainties still, but every week, every month, the updates are there, both by WHO and other major organizations, inclusive of Foxy, and we change gears. But just look at what has happened 200 years ago, 1747. Linton showed that citrus juice supplements eliminate scurvy. Isn't that quite a simple thing? Citrus juice, vitamin C. Give it all to the Navy men who were suffering from scurvy. Looks so simple, looks so doable. To implement this citrus juice supplement by all the kind of evidences that they had to find, and then, finally say it is safe and it's worthwhile and it is to be given. It took 194 years after the level 2 evidence to actually give that citrus juice to the British Navy in order to bring down the rates of scurvy. This is the same story with original research. It takes time to submit it. Then for acceptance, they will take, nowadays at least, some onlines are doing in 3 days, 1 week, etc. But otherwise, typically 3 months or maybe even a year. And by the time it goes to publication, the database, the review, guidelines, all together, so much of the original research goes into trash, and only 14% which benefits the patient care finally crystallizes and comes. By that time, for the newer generation, you can quite imagine that there is a change of scenario already. What they have said and published, and by the time it reaches your table, the situation at hand is quite completely different. And main influencers or the decision makers, like many of us, we say, don't confuse me with facts. I have made up my mind. I don't believe the change is necessary. For years I've been practicing and this has worked for me. So when we say that, that is the constraint of training the teams with the latest, the recommendations either from the WHO or from Government of India or Foxy, because the boss is not updated. She says, nee, this is not the way I used to do. So now what y'all are coming to teach me? So they don't believe that this intervention is effective. Now you say don't use this drug, use labetalol, for example, this, that, and the other. So, the behavior change is really, really difficult. Sometimes the resources are so poor that you may say robotic surgery, how she will do in a remote corner in a rural village. Yeah, they will, to develop the skills and to have the affordability. So everything that is new cannot be implemented. There is so much gap, as I told, with research and reality, even the endoscopic surgery, for example. So you have to be pragmatic. Once upon a time, I didn't even know the actual dictionary meaning of the word pragmatic. It just simply means have your common sense, have your head on your shoulder, and just because your heart is asking you to do so many things, no, please be practical. See whether what works in which situation, and believe that reality is constantly changing. So what you yourself have claimed on many platforms today may change tomorrow. Be humble enough to accept that and confess and change gears. So what did we work on? What was my journey through research to reality? Well, we declared a vision called Vision 2022, even before our Prime Minister Modi ji did it in 2014. This vision was declared in 2011. Okay, when I took over as the president of the Karnataka OBGYN Societies, I said, no, I have a vision and it's quite simple. Let's go back to basics. A, B, C, D, E. So what is this A, B, C, D, E? A is for adolescent care and anemia care. B is for building contraceptive choices. C is cervical cancer. Kill it before it kills you. D for diabetes. Don't let India become the diabetic capital. E is emergency obstetric care. And the ... is etc. because there is so much more to do. But you have to bring some key issues into focus. Anemia, we've been talking for so many years, and why this is not, how can we get the girls into the pink of health before they embark into the pregnancy? So there began our intravenous anemia story, because the guidelines from the West say patients who cannot tolerate and who will not take oral iron, only the parental iron has to be encouraged. And therefore, our government also gave the IFA tablets, iron folic acid tablets, for years and years and years, and nothing happened because only 30% used to take, out of which 30% good absorption, out of which the fluoride in the water interfered with the absorption. The chai and the supari that they used to eat also interfered with the absorption. The chronic intestinal infection, worms, etc., etc. So there's a lot happening around the iron tablets. So the parental irons made a comeback. We had to inculcate the fresh thoughts, because our time, parental iron, Jectofer and Imperons, they could kill the women. Okay, because anaphylaxis and side effects were, so even in our minds, it was a clear no-no. So we took a whole survey of what are, when we have discarded those old parental irons, if we have to give parental iron, what can we do now? And then we recognize that there is a drug here which is approved for use, but nobody is using it. Only 2% of the OBGYNs are using it. Why? Because everybody said, we want more information on this. We want more studies within the country. We want your experience shared. And then you tell us to use. Then 2007, Professor Manyunda, who's from UK, who is my guru for the research work. So Divakar Manyunda published a paper which showed that the parental iron really brought down the moderate anemia from 76% to 19%. In another group, 81% to 18%. There was a very, very, very significant difference just with 2 doses of intravenous iron sucrose. And this study was looked at very, very keenly by Professor Padmanabhan and team from Tamil Nadu. And he said, no, let's get started and see on a mass public health scale whether it works. So more than hardly 200 ampules of intravenous iron sucrose were selling. And in the course of 5 months, there were 2 lakh ampules which were selling. That means so many more patients got benefited of that. And slowly the initiative started escalating, and it reached the nooks and corners of India. Leela Joshi, who is a very, very dear friend, who has received the Padma Shri for her work on the tribal women, where she's made them all lie down in a line and giving the intravenous iron sucrose in a camp setting, because every single day, 50 tribal women were given this, and the level of hemoglobin, remarkable difference just with one visit. We are now marching towards the Anemia Mukt Bharat. Any new treatment method will face the challenges, but having an example like Tamil Nadu and in remote places like Ratlam, we know that there is a possibility to drive the change towards Anemia Mukt Bharat. The newer thoughts on anemia. I said, okay, madam, if you're intravenous sucrose, you're claiming it's so good. Expert group meeting was there, and then we put it in the guidelines. 2018 guidelines of Anemia Mukt Bharat, anemia management protocol for pregnant women. We are all the time, please reflect for yourselves. We are all the time thinking only of the women who is anemic, and we are worried if she's severely anemic closer to the delivery date and she bleeds a little more, we may lose her. Okay, so the guidelines said in third trimester of pregnancy, if you find that she's very severely anemic, okay, give the intravenous iron sucrose. But what we got to remember is the peak transfer of iron from mother to child happens in the mid-pregnancy. You wake up too late and you're giving the same drug just to save the mother's life. See what happens to the child. The low birth weight, abnormal cognitive development, increased risk of schizophrenia, long-term neurodevelopmental impact on the newborn, which cannot be reversed. So if you're giving it, now we are urging the government to change the guidelines. By mid-trimester, ideally treat the adolescents, get them to the pink of health. But if she's presenting herself only in pregnancy, then you will need to make her non-anemic by mid-pregnancy so that both herself and her child will benefit. Because the low birth weight babies, please do recognize that long-term problems of hypertensive disorders, diabetes, etc., they will have. So despite our best efforts, anemia still holds a tight grip on the Indian population. So what have we done? As I said, Sankalp and Santwani with us have to take the Shapath. Yeah, it's all SSS. So it is YES, 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 and yes, because path towards Anemia Mukt Bharat, in line with the Foxy vision and the Government of India vision. We said be Pledge for 9, 12 by 12, Poshan Abhiyan, which is the nutrition, as how we are speaking today and tomorrow. Foxy is celebrating the nutrition weekend, everything in a wholesome manner. We have to get everybody together and resolve that we will solve this problem. All of us should make the dream of Anemia Mukt Bharat a reality. So this much for research to reality, from oral to parenteral to the newer thoughts of anemia. That is the A. The B, the building of the contraceptive choices. One initiative is digital platform is a buzz for the youth. So get them to be aware with authentic information. Ritu should do more shows on the platforms of social media where the youth, we have produced a paper saying only 5% of the youth come to the healthcare providers to seek any information. 80% or 85% are on the digital platform to get their information. Another 5 to 7% peer group. The last 5%, parents, teachers, or healthcare providers. So you know how to reach them and where to reach them. Another is workplace intervention. Big factories, construction workers, migrants, the corporate units, everywhere you reach the care to them by awareness, the cafeteria approach. Just let them not think about it. They have to start using it. There's a huge unmet need, and 15 million abortions are happening in the country every year. And if you don't space out the pregnancies, it is a killer by itself. And therefore, PPIUCD, again, to empower the nurses. Okay, task shifting. It has to be placed within 10 minutes after delivery. And if 40 deliveries are happening per day, you are busy doing your OT cases and by ectopic pregnancy or some laparoscopic surgery or God forbid. The staff nurses are there. the patient has already consented. She cannot wait for you to go and do the process. They have to be empowered. They have to be trained very, very seriously. And this is our initiative, Foxy Figo initiative of PPI-UCD, where percentage insertions you see in the JNM Calcutta, that is in the Kalyani Hospital, the PPI-UCD insertion, zoom, it went up like a rocket when we trained the nurses to do this job, because they were available, they did a good job. And you please see this next slide. 2016, 2015, there were only 11% of the insertions by the nurses. 2016, 86% of the nurses started, actually implementing this. 2017, 99%. So on the whole, many, many thousands of insertions happened through the nurses, and the complication rate was similar or even lesser than the qualified consultants. And as it is, the complications of perforation or infection actually did not happen. If you take expulsion as one of the complications, it was less than 3%, which is a very, very good score. So this is what we did about the building of the contraceptive choices. I'm not talking much about the cervical cancer, because to embark on a major initiative of advocacy for HPV vaccine, okay, we tried a lot to tell our peer group of doctors that this is the way forward. 80% pap smear abnormalities will come down if you give the HPV vaccine to all the young girls. But till now, it did not work. So we changed the methodology. I said that you have to think out of the box. And now the girls and women know about this. So they are coming and asking for a bit. So the demand generation has been our approach as of now. And places like Australia have initiated something called GNV, Gender Neutral Vaccination. HPV vaccine you give both to the boys and girls. Okay. So by 2050, like polio virus got eradicated, they want the HPV virus to go. Totally eradicate the HPV virus, so that the 99% reduction of cervical cancers and nearly the same amount of reduction in all other cancers and problems caused both in men and women with the HPV virus. That is what is the vision of the West, which has to really spread like wildfire in our own country. So HPV vaccine, please do remember, any touch point, anytime, please place the information. Today, the girl may be young, she may not be able to decide for herself. Aspirational India, when she starts earning for herself, if she thinks it's an important thing to spend for herself, let her have the knowledge that this is available. Now we are looking for COVID vaccine desperately. The cancer-provoking HPV has already a vaccine, but it's not reaching people. It's not even reached 1% of our girls and women in the whole country. So that needs to be changed. And I have not put the slides because I don't want to keep talking about it. Let me do something, make an impact, and then we will bring it on to the next Ritu show. The A, B, C, and D. D is diabetes, 30 million deliveries. Just today, when we are having a training program on Manyata for the Tamil Nadu group, I said, can you guess how many deliveries in India? Somebody said 1 lakh deliveries. Somebody said 10 lakh deliveries. And they were shocked to see there were 30 million deliveries. So in each one small setup, they cannot imagine that the nurses are so important because the numbers are not matching. For 30 million deliveries, we need 1 million nurses who are knowing what they're doing. And we don't have that 1 million. So that is our main, burning issue now. So out of this, 10% also, if you take, there are 3 million diabetics, and everywhere, you see the scenario is so different. A posh private maternity home, look at it differently. There is a huge crowd, 200 people in the antenatal. What will you do to whom and how and when? And there are some who land up only for delivery in the primary health centers, and they have seldom had an antenatal checkup. What's done, what is desired. We are far from reaching the universal screening target, because the recent data from NFHS has shown we want to test 100% of our pregnant women, but how many percent are actually getting tested? 15.6%. So we have a huge gap in the testing itself, and forget the fasting sample. The simplest of the things, the policy change we have brought in doing the single step test. Don't worry about fasting or empty stomach. Don't worry when she's had a last meal or breakfast or lunch or whatever. Whenever she lands, 75 grams of glucose mixed with 300 ml of water, she has to drink it within 10 minutes. And at the stroke of 2 hours, she has to give her blood sample. If the value is more than 140, she's already labeled as a GDM, and you move on to the management of that. Easily doable. 3rd month, 6th month. Now slowly, at least in the nurses training program, each and every nurse gave a wrong answer before we started the training program. Each and every one of them in every private centers. Maybe they are doing the right things, but the nurses does not know. Doctors may be busy. What they have instructed the patient, whether the patient has understood or not, the next touch point is the nurses. They should know, and they should tell, and they should make sure that every patient walking into that center has got it done. So this is about diabetes. All the Foxy leaders are here saying, defeat diabetes. Don't let India be the diabetic capital. Move from awareness to action, from illness to wellness. Ritu said that me and diabetes go hand in hand. So we say the sweet connections between me and the whole community. And we have also launched a sweetheart program. Sweet disease today, leading to heart disease tomorrow. That is the tag message that we want to give. And we have shown this little child with the 75 gram glucose in the hand, telling that bacha bhi janta hai, that that this needs to be done for every mom. So go ahead and do it. Last of all, I was just telling you again and again and again about training of the paramedics. Where you live should never determine if you live. The same lady in Mumbai has good chances of survival with the same situation. But in a remote corner of Jharkhand, she'll surely not make it. So where she lives gives her an opportunity to live or not to live, which is a very sad situation. Every person, everywhere deserves every opportunity to survive and thrive. So the task shifting, my crazy dream of empowering 1 million frontline healthcare workers, going on really seriously and rigorously with the digital mode of training since the last 3 years. And nobody would believe that the skill transfer can be done on the digital platform. Now Corona has made everybody believe. So I'm very happy that many, many more centers are joining in. All of you are welcome. We have our service trust, which is supporting enrollments and teaching program for the certification course on Manyata, where the Foxy lead assessors will come and check out on all the 16 clinical standards, starting from antenatal care to intrapartum care to respectful maternity care, complication management of PPH and eclampsia, pre-eclampsia, postnatal care, and the Robson's criteria for C-section. Each of our nurses who are trained 100% verbatim, because the passing marks is 90%. If they score it, that 1%, that 10 marks I have left for partogram, because half of them are still, not really wanting to do the partogram, but e-partogram and other things we are bringing in. But at least they know that they have to supervise the delivery. That much they are sure. And the skill transfer program is entirely based on skilling. I always tell them, you fly so many times, the air hostess is keeping on telling how oxygen mask falls here, put this, put that. Unless you do it yourself, do you think in a panicky situation you'll be able to do? Most often, half the passengers will make a mistake. So doing is believing. So lots and lots of paramedical healthcare providers, Rajasthan, Assam, UP, Karnataka, Tamil Nadu, Maharashtra, we want to reach out to more places, and please help us do more than what we are already doing. So very many collaborators. There's Japigo, there's Foxy, there's MacArthur Foundation, there's MST from others. We believe in connecting and collaborating. So if it's so important to you, you will find a way. You will not find an excuse. That's what I strongly believe in. And collaborating to Skill India is truly a very strong mission. To produce evidence, you have to sweat it out, because it's not very easy to have a refined group of patients as well as the providers who can really document and produce evidence to action, reality bites. Still some uncovered zones are there. routine augmentation of labor, routine use of antibiotics, the tocolytics for prolonged period, progesterones, the scale of sales is like reaching the limit. That means so many are using progesterone empirically. Is there, again, many practitioners will say, now don't confuse me. That you told me not to use, I did not use, and see what happened to my patients. She will go to the neighbor next time and not confuse. So all kind, aspirin is again looked as a huge panacea. And when we ask, we are always taking the surveys and doing the research, they say it's better to augment, families also want it, muhurat is there, and if you wait for ideal situations, it's not practical. Oh, there's no harm, every case I augment, so shorter duration of labor is better, this, that, and all. Unsupervised augmented labor is really a danger. This slide, whenever I put it, the audiovisual person goes aghast. They say, madam, ye to slide ulta hai. अरे काम भी उल्टा कर रहे हैं, इसलिए स्लाइड उल्टा है, because adherence to protocol is not a simple thing. The practices which are called the best practices are by research and evidence proving that practice works. The practitioner's opinion about what works in practice is also important. Cultural and social context, which determines how a practice will work. So everything. Don't think that we are the only ones who are not following protocols. Look at this survey in the UK, okay, where are they complying with NICE guidelines? So this was a survey published way back, about 10 years back. Majority, the maximum doses were exceeded by 86%. Okay, intravaginal prostaglandin tablet, that they exceeded, 61% of the practitioners were using any dose that they thought and not as per the guidelines. And there were so many more studies like that, which truly, if you audit anywhere in the world, what is practical, what is feasible, only that you can do. So please, let's recognize that and be pragmatic. And anything we do in India should be low cost and meant for not the niche ivory tower practitioners and patients, but everywhere. So here is our ABCDE, her journey through the ages. We want to improve the women's healthcare and the ecosystem in India. And at least this 5-pronged attack should get us a long way to fulfill the SDG goals, Sustainable Development Goals. Goal number 3, which is called Good Health and Well-Being for All. Oh, what does it really mean? We have to reach, and the target available to us is a pregnancy. What kind of care we take in pregnancy totally reflects on how the next generation is going to be, because it all begins in utero. You don't take care of a mother who is hypertensive. You don't take care of a mother who is hyperglycemic. Her baby will be programmed to become childhood obesity and young adult hypertensive and young adult diabetes, the tsunami which we are saying. So, dear friends, I truly believe that everybody has a role to play. You do your bit to make a difference. And in conversation with Ritu today, I've really enjoyed the late night show from research to realities. And I thank her, thank Sankalp and his company, and of course, all of you who have stood by us to watch this, to imbibe and absorb not a great lot of technical knowledge, but to pay attention to what you're doing and why you're doing what you're doing. And can you do any better than this? And believe that whatever you're doing really makes a huge difference to the women and girls out there. Namaskar.
Amazing, ma'am. Amazing. Mesmerizing. Thank you so much, ma'am. Thank you so much for enlightening us. Ma'am, you again motivated us to do lot of good work. Ma'am, as you already mentioned, to do more and more public awareness. So, ma'am, I am already doing one public awareness program every Friday, started in the lockdown period with the name Digital Health 360 Degree for Women.
Super.
Thank you so much, ma'am. Ma'am, means I have no words that you have spoken so nicely, ma'am. I would like to felicitate you by this shawl, ma'am. So thank you so much, ma'am. Thank you so much, ma'am.
Yes. Thank you.
Yeah.
You know, this is again one more thing. As we grow in stature, we have to be humble enough. That is one part. But as the young people are moving ahead in their journey, the kind of respect that you exchange with us makes a huge difference. The attitude of gratitude always will get you very, very far. And that is another special quality, Ritu, which I must appreciate. Thank you very much.
True, ma'am. Thank you so much, ma'am. Ma'am, before we take questions, ma'am, I want to know, please give us some tips for the young budding gynecologist.
Actually, I've said it all right at the start and through my lecture, but because I do believe that their tip should be innovation to implementation to make an impact. Please strive for that, because just your innovative ideas, because young minds, jugaad, innovative. It's so easy to teach a group of Japanese because A, B, C, D, A to Z, they will do the same thing. Whereas Indian team, no, this, that, they'll do this and they stumble upon something brilliant. That's how most of the research happens, dear friends, because they are looking for something and they will hit upon something else. That's how even that anti-abortion tablets, because it was used for some gastritis initiative when they found that it is cramping the smooth muscles of the uterus and it can help in abortion. So it is, the innovation has to get implemented. You may not always be right, but don't be put off. This is a very complex country and a very diverse country. You do something today and you expect the results tomorrow? No. How a farmer sows the seeds and waits. Nothing happens overnight, but something may come up or something may not come up. You reap as you sow. That you must remember. Have your patience, and I have often said, lage raho, because you will find the impact of what our Esther generation has done. That is having an impact on us. We are not the same as they were. So what you do will have an impact on the next generation. You take care of the pregnant women today, all the babies program, prosper, healthy generation. If you look at yesterday all the time, you can't have a better tomorrow. So this is my message. Don't give up. And I will repeat again, to win, you must begin. And one last message, because of this social media, so many contradictions. Yes, just, take it as everybody has the right to opinion. Say what you want to say in a gentle way so that the message is taken, but you don't rub the wrong side, because we are all in the same team. If you believe that, then everybody is a winner, because we are all in the same team. This is what I call as a win-win situation. And again, I will like to underline and say, to win, you have to begin. So that's the message.
Wow, ma'am. Wow. Amazing, ma'am. Ma'am, thank you once again from the bottom of my heart. Ma'am, there are so many appraisals are coming for your amazing talk. Dr. Alka Madam has joined. Alka Kuthe Madam has written a wonderful efforts. Dr. S.P. Jaswar Ma'am. So many doctors have written. Vaibhav,
These are all my very, very beloved friends. Thank you.
Ma'am, yes. Vaibhav, can I take the questions of YouTube or Facebook? Can you please paste here? I think all are appraisals only, ma'am. No questions. Everybody is very, very much satisfied.
Jao, tumko jo karna hai karo.
Nahi, ma'am. No, amazing, ma'am. Bahut hi acha.
No, but I think that
yes, ma'am.
The community of all our friends have been like, they are my true champions. They have really unconditionally joined hands to amplify the kind of work that quite simplistically we have tried to do. And because of that kind of a support, somebody has to start. Why that only one person has to start? Because they have to take the risk. They have to have the courage, because you may often fail and you will be really, really criticized. That's why I said 1,000 failures. We have, digested a lot, but it's okay, because you still want to reach where you want to reach. And for that, everybody has had the trust and come along with us. And I think that has been my greatest blessing, and I am ever so grateful to my friends and thankful to God for making this happen. And I think when you say success, I don't look back with any regrets for my failures. That is my success.
Yeah. Thank you so much, ma'am. Ma'am, there is only one question from Dr. Sunila Naidu, madam. She is writing, ma'am, after innovation and implementation, what do you suggest next, ma'am?
Impact.
Yes.
You innovate, you implement it, and you see the impact.
Yes.
Of the thing.
Yes.
Because whatever you do, it is not just for just saying and boasting that you have done that. Okay, whatever you think, you can't just be saying you have great ideas. Has it brought about impact? That is why the research component is so crucial, because unless you document what you've done, unless you see and study what you've done, you are just carried away with your own, hava of having done so many bigger, but you come back down to earth when you know that some things have not worked, because not always everything will work. It may just be coming across that, sometimes we're very optimistic, very positive, but we have to learn to celebrate our failures as well, because that is what is actually persistence as actually, because you can't afford to be, though I said you work from your head and heart, you can't afford to be sentimental on certain things. People will criticize, but you need to move. Yes.
Yeah. Ma'am, again, a lot of appreciations are coming for you, ma'am. So thank you so much.
And all the appreciations for all of them and to you especially, because I really, this is like in conversation. Okay.
Yes, thank you.
It feels good.
Thank you so much, ma'am. So friends, with this, we will wind up our show, though our show timing is only half an hour. But ma'am's amazing talk, we have crossed the 1 hour. Yeah. So with this, we will wind up the today's show. So thank you once again. Thank you, madam. And thank you, InnovaCare Life Sciences. A special thanks to Sankalp, Harish, Dipenji, Mr. Amit ji, Lalit sir, and all. Yeah.
And
over to you,
Ritu,
Sankalp.
there are very many of my known friends who have watched this and they have sent personal messages. My very heartfelt and personal thank you to them, and thanks to you for helping me reconnect with them, because Usha Nath has met me in 2013, but still, we have said a fond hello to each other today, and it's been really nice.
Nice. Thank you. Over to you, Sankalp.
Thank you so much, madam. The tremendous efforts we have seen, doctor, you have taken for public awareness and training medical and paramedical staff. And hats off to you, madam, that the hard work which you have taken.
Sankalp is asking me, PCOS के patient आते हैं क्या मैडम, endometriosis के patient आते हैं, कहाँ जाएंगे भैया? Corona, the deliveries have to happen, menstruation has to happen, whatever they're living with, they have to take care. So Sankalp, you'll never run out of business.
Yeah, very good. Yes. So ma'am, once again, thank you so much. And we at InnoCare also helping India to free from anemia. We have a brand to help the nation, the pregnant ladies who are suffering with IDA, iron deficiency anemia. And we have that ferric pyrophosphate brand, HB. So we at InnoCare, we have taken a pledge to make anemia free India. So with this...
so you have to make it, Sankalp.
Yeah, we are conducting hemoglobin detection camp. Because of this today's pandemic situation, from February onwards, we have stopped. But we have been taking, this.
See, detection mein kya hua? I will, at the closing also like to say that we know the problem. We have spoken enough of the problem. It's time to find the solutions and act upon the solution. What next karke? Very, very sharp question was asked. Yes, we have to see the impact. Itne jan ke kiye. Pata hai 50% of them will fall below the line. So let's invest our energies and our resources into making a difference. Yeah, Sankalp? So this is the message.
So this is a good theme, ma'am. Thank you so much. The good theme, make it a difference. Thank you so much for giving us the theme and the benchmark to carry forward the business with us.
Yeah.
Thank you so much, ma'am. Good night, ma'am.
Thank you, Ritu.
Yeah, thank you. Thank
you
you
for
so
the
much.
flowers and the shawl, which I will collect later.
Yes, ma'am. Sure. Thank you. Before we wind up, a big thanks to our technical team, Mr. Weber too. उसका नाम कैसे भूल सकते? He's the back support of our. Yeah. Okay. Bye. Yes.
Bye, everyone.
Bye.
Have a good night and have a lovely Sunday. Namaskar.
Namaskar. Yeah. Stay safe. Stay healthy.
Yes. Right.